Hey everybody, let's go through the pathology of nutrition and environmental diseases. So, xenobiotics are exogenous chemicals that are usually lipophilic, so they can be quite easily absorbed. They're eliminated via phase one, where the chemicals go through hydrolysis, oxidation, or reduction. And the catalyst of import is cytochrome P450, and then the products are made and metabolized into water soluble compounds into phase two. In phase two, glucuronidation, sulfation, and methylation will be able to metabolize the xenobiotics into something water soluble. Glutathione is going to be the antioxidant that will neutralize any free radicals. And since they are water soluble, they're going to be eliminated via the urine, the bile, or the feces. If you can't do phase two, they're going to accumulate in the tissue. So the tissues would be the liver and the skeletal muscle. Those are the big ones. So the direct activation or mechanism is in the gut lumen or the lymphoid organ. So these are going to be your Peyer's patches, where it is going to be detoxed and bound. And in the indirect mechanism, it has to be passed through the liver. So the liver is going to handle the sulfation or the methylation and the glucuronidation. So the air pollutant of import are going to be carbon monoxide. The other are going to cause like pneumocosis because the particles like nanoparticles, ozone, particulate matters are going to accumulate, and there's going to be non-caseating granulomas forming in the lungs, except for the acid aerosols that will actually just scar the lungs. But carbon monoxide is of import because it inhibits the cytochrome oxidase, competes with oxygen, and then leads to the systemic asphyxiation. And the main clinical signs is like the cherry red skin coloring, and you have to be really careful because you can't just rely on this as a diagnosis. People with very dark skin, it might not show up very well. So instead, you want to rely on the O2 saturation levels and the signs. So the dizziness, the nausea, and the changes in alertness. Other ones you got to be paying attention to are the cigarette smokes, aerosols, radon, and formaldehyde, because that will cause lung cancer. Okay, so the direct cell injury leads to the acute or chronic inflammation. Enhanced proteolysis is going to lead to emphysema, which is a restrictive lung disease, and asthma is going to occur if irritants enter the lungs, and it activates IgE. The immunologic injury is going to result in the hypersensitivity pneumonitis, and the fibrotic reactions are going to be caused by the cytokines released in response to the particulates. Radiation and chronic damage is going to lead to changes in the cellular structure, in the cellular DNA, and that can propagate over the generations. Heavy metal poisonings are all characterized by the CNS abnormalities and peripheral neuropathies. Lead is kind of special because it increases cartilage formation, so it's not going to heal fractures well. It inhibits the D-aminolevulinic acid dehydratase and ferrochelatase. So this is particularly important because no heme is going to be able to be made. So it's going to result in the microcytic hyperchromic anemia. And we can see it in both like the Gemsa stain and the Prussian blue stain. So here The cells are going to be they're going to result in the basophilic stippling in the red blood cells. You can see a lot better with the gemstone staining. And in the Prussian blue, you're going to see a ring formation. So that's called the ring sideroblast. Okay, so mercury poisoning is going to bind to the sulfhydryl group in the proteins, and it damages the CNS and the kidneys. It's going to result in the tremors, gingivitis, bizarre behavior, and it is very, very, very dangerous to newborns, or not just newborns, but developing fetuses. So mothers or mothers to be should avoid any kind of fish with high mercury levels. So I didn't do a lot of research in that, but I think it's going to be like salmon, anchovies, fish like that. But you have to be very, very careful. Minamata disease is a disease found in Japan, and they discovered that cerebral palsy, deafness, blindness, and mental retardation, CNS defects occur when mothers are exposed to mercury, and this is what their children develop. Arsenic poisoning is going to interfere with the mitochondrial oxidase phosphorylation. In a pathology insight, like we've been through arsenic poisoning back in biochem. Go back to those lectures to refer to that. But it's going to lead to skin cancer. They have effects on the GI, cardiovascular, and CNS systems. Chronic signs are going to be hyperpigmentation and hyperkeratosis, which are going to be your Mees line. And importantly, it has an increased risk of lung, bladder, and skin cancer. Cadmium is going to result in a obstructive lung disease, renal tubular disease, kidney cancer. This is really found in people who work in like the industrial industry, so like car factories, construction. Itai disease, which literally means ouch ouch, Japan, it is going to be characterized by painful osteoporosis and renal disease, and in high levels it can even like warp the spine. Okay, so the most potent carcinogens in tobacco are going to be your polycyclic aromatic hydrocarbons, your nitrosamines, and your aromatic amines. They have an increased risk of gum disease, not just from smoking. This is from doing like dip or chew. Lung cancer, smoking of course. Esophageal cancer, oral cancer. That can both result from dip or smoking. It interacts very well apparently with alcohol to increase the cancers, not just in the oral cavity but also in the stomach, the bladder, and kidney. It also increases the risk of atherosclerosis and myocardial infarction. And of course, there's going to be a predisposition to emphysema, chronic bronchitis, and for children, there's going to be growth retardation. The fetus is going to be hypoxic. There's going to be a low birth weight. In some cases, there would be a spontaneous abortion. Placenta previa can occur. And these are the same effects of alcohol by itself and cocaine. So combine all of those together, the kid is not going to have a very good chance at life. Okay, so acute alcohol abuse is going to cause drowsiness, and then there's going to be a stupor, and then lastly a coma, thanks to a CNS depressant. So it's going to be oxidized to acetaldehyde in the liver by alcohol dehydrogenase, cytochrome P450, and catalase. Alcohol oxidation is going to deplete NAD, which leads to the accumulation of fat in the liver and metabolic acidosis. Thanks to the depletion of NAD, have you ever heard of people drinking a shot of beer during a marathon because apparently that's supposed to give you energy? That's actually wrong. It depletes the NADH because the body's trying to metabolize this poison. It can actually lead to death if you're too fatigued, and the body is going to try to address like the the most critical danger, right? So the most critical danger is the poison. So the body's going to detox, it's going to take away energy, and the person might collapse. So these are the chronic signs of alcohol abuse. It's going to lead to, let's see, the important ones are going to be the portal hypertension, pancreatitis, hepatocellular carcinoma. There's going to be bleeding from gastritis, the gastric ulcer. There's going to be cardiac myopathy. And there's thiamine deficiency because alcoholics don't eat. Alcohol is it's empty calories, it's just sugar. So there's going to be Wernicke-Korsakoff syndrome. We've covered that before. And these inclusions called mammillary bodies, they're going to be in the brain. Cancer risk, oral, larynx, and esophagus. Okay, Mallory-Weiss tear is a physical tear from repeated forceful vomiting. And they're, thanks to all the constant exposure to the acid, it's going to change from squamous to columnar cell to protect, right? So that can be very problematic because it can lead to Barrett's esophagus, which is cancer. In alcohol abuse, there's going to be vomiting, esophageal dilation, and the rupture because of the forceful vomiting. So patient's going to come in and they're going to say, oh yeah, I had repeated vomiting for like 2-3 months, and the first couple times it's bloody, and now it's not. So that means that the cellular change has been basically complete. So now we got to be worried about neoplasia. If the blood is going to be able to enter the mediastinum, that is super problematic because mediastinitis is very, very, very hard to treat. Like, it's in the mediastinum. How are you going to drain that, right? If there is going to be pus forming, if there's an abscess formation, like, how are you going to drain that? How are you going to directly treat the area? Okay, so medication we got to be worried about. Oral contraceptives, because they lead to, like, the big one is thromboembolism. It can also lead to the hypertension, cardiovascular disease, hepatic adenoma, and gallbladder disease. And aspirin overdoses can be alkalosis followed by the metabolic acidosis, nausea, tinnitus, bleeding. In children, Ray's syndrome can occur, and that causes a reversible liver damage, so it's going to be a fatty liver. It's only in children, though. As you can see here, there's going to, the signs are encephalopathy and the liver damage. Gotta be worried when the kids become like they're going to vomit, and then they're going to be sleepy and seizures. There's no pupillary reflex. We gotta be worried about the coma. Acetaminophen is going to cause hepatocellular injury, centrilobular necrosis in the liver, which is irreversible, so it's not fatty liver changes. Kidney failure due to the papillary necrosis, and it's going to result in the alkaline urine. And so in the aspirin, it's going to be acidic urine. So acetaminophen, alkaline urine. Steroids, there's going to be changes in the secondary sex characteristics, along with psychiatric disturbances and risk for myocardial infarction. So right here is going to be your central lobular necrosis, or the papillary necrosis. Sorry, these are like tiny kidneys. This is a fetus's kidneys. So in the renal papillary necrosis, this is the mnemonic sporadic, so it can be caused by sickle cell disease or systemic vasculitis, pyelonephritis, so an infection. It's going to cause the pus, obstruction, renal vein thrombosis or transplant rejection, analgesic nephropathy, so that's going to be the acetaminophen overdose, diabetic nephropathy, infections, in particular tuberculosis, and liver disease. Okay, so poisons. Cyanide is going to inactivate the cytochrome oxidase. It's going to uncouple the mitochondrial oxidative phosphorylation, and all in all, inhibit cellular respiration. So you're not going to have any ATP. in aflatoxin B1, it's going to be caused by a particular fungus, and it's going to be in improperly stored foods, causes the weight loss, painless jaundice, pitting edema, cirrhosis, but it can lead to hepatocellular cancer. Okay, so the occupational diseases, naphthalene dye, it can also be like napalm, it causes bladder cancer. Vinyl chloride causes liver angiosarcoma, so sarcoma of the vessels of the liver. Dry cleaners, so carbotetrachloride can cause liver cancer. Asbestos and fiberglass could cause mesothelioma, silicosis, bronchiosarcoma, and beryllium disease is going to mimic the sarcoidosis, so it's going to be similar to the silicosis. Okay, drug abuse. Cocaine. So this is going to be a stimulant. Of course, there's going to be problems with tachycardia that could lead to myocardial infarction, hypertension, periphery and coronary vasoconstriction, fever, hyperpyrexia, and paranoia. Opioids, hallucination, sleepwalking, sedation, lung injury, and kidney damage, of course. Amphetamines, there's going to result in violence because of the confusion, the psychosis. Marijuana can lead to schizophrenia in patients with a family history of schizophrenia, or schizotypal syndromes in patients without a family history. And of course, there's going to be respiratory damage if smoked. Heroin, the death will result from respiratory depression. Okay, burns. First degree, superficial. Second degree is partial thickness, so it's going to injure down to the dermis. Third degree is going to be full thickness, so it's going to be injury to the subcutaneous tissue, even down to the muscle. This one's the most dangerous because it can lead to shock, sepsis, respiratory insufficiency, thanks to the systemic inflammatory response. So shock due to the loss of liquids because the skin is not there to form a barrier. The most common pathogen in the burns is going to be Pseudomonas aeruginosa. This is important to know. And the complications is that if you don't treat it and keep the wounds moist to kind of slow down the collagen and fibrosis formation, there's going to be hypertrophic scarring, and it can contract when it heals. Not so bad on the superficial, but let's say you have third degree burns and it's in your neck, right? So if there's a lot of significant constriction there, the person is going to have difficulty breathing and they can die from respiratory distress. Hypothermia is going to be direct cell injury thanks to the crystallization of water, and indirect injury due to the vasoconstriction and the vascular permeability. So the crystallization of water is going to mess up the cell membrane, of course, and it's going to cause the cells to burst. Trench foot is going to be a combination. It's going to be vasoconstriction to kind of preserve the blood, and the increased viscosity of blood. So the blood, the veins are constricted and there's not any blood going through, so it's going to lead to gangrene. Okay, so heat cramps are going to result in normal body temperature, but the cramping is due to the electrolyte loss. Easy treatment: drink some Gatorade, cool down, take a break. Heat exhaustion is going to be due to water depletion and electrolyte loss. There is the failure of the cardiovascular system to correct the hypovolemia. Person is going to pass out, but they are going to be able to sweat. So this is the important thing. Like heat exhaustion, person is sweating. They are hot. You want to cool them down, cover them in ice. IV electrolytes is a little bit extreme, but you want to cool them down, put them in ice or an air-conditioned room, give them a lot of Gatorade, and let them rest for a day. Heat stroke is the most dangerous. And the core temperature is going to be very, very high, but at the same time, the person's not sweating. So this is the important one to know. Core temperature is high, but there's no sweat. There's multi-organ failure, vasodilation, importantly, the hyperkalemia. It's going to lead to the tachycardia, the arrhythmias, and the rhabdomyolysis is going to occur. So there's also protein in the urine. This is the one where you have to be hospitalized. It's a lot rarer, but this is when the patient faints, and then when you feel their skin is going to be like very cool in comparison to like what you would expect it to be, right? Or it's not cool, I'm sorry. It's going to be very hot, but it's very dry. There we go, sorry. So electrical burns electrical injuries can result in either burns or ventricular fibrillation. So if there is too much electricity passing through the body, it can mess up the cardiac and the respiratory center signals, and there's death by asphyxia. Radiation is going to damage the DNA directly. There's going to be fibrosis at first, mutagenesis in more exposure, carcinogenesis in long-term exposure, and then in children, teratogenesis. It's going to be due to the free radicals, of course. Okay, so that's it for now. Thank you for your attention, and next time I'll see you for the nutritional diseases.